I'm audible? The screen is clear? Okay, so everything is fine. Please let me know so that we can start the session. So I'm just checking in the live chat. Okay, so my dear students, can we start the session? Please let me know. Good evening to everyone. Okay, so today's topic of discussion is a long question which comes in the university paper. That is mammary gland. Okay, so we have to study mammary gland in detail. Why? Because it's a question, it's a very important question asked in the university exam. Yeah, hello to everyone. Okay, welcome Sakshi. So everything is fine. We are good to go. Yeah. Okay, so if I want to I want before starting the session that you should be aware of all the things which will be covered in today's session. What all things we are going to study about mammary gland, that is very important. So let me just let you know that mammary gland will be covered under following headings. Okay, it will be covered under following headings. So firstly, I would like to introduce you with the mammary gland. Which type of gland is it? Then I will tell you about the extent, where it is located and from where to where, medially, laterally and vertically, the extent superior to inferior. I would also like to talk about its important relations, the structures, the parenchyma, the stroma, and the blood supply, the nerve supply, the lymphatic drainage, and the clinical anatomy. So all these will be covered in today's session. That is very, very important for you to know. So let's start firstly with the introduction part of the mammary gland. So as you can see here in the diagram, that the mammary gland has been shown you, and you can also see in the center of the mammary gland we have got the areola, and we have got the elevated structure, that is nipple. So if I just want you to know about the mammary gland, which type of gland is it? So it is a modified sweat gland. So very important point which everybody should know. The mammary gland is modified sweat gland. Mammary gland is modified sweat gland. And the other important point, in the study session, we have covered the pectoral region, where we have seen the pectoral muscle and we have seen that there is pectoral region fascia. So in the superficial fascia of pectoral region, we have got the location of mammary gland. So mammary gland is present in superficial fascia of pectoral region. Okay. Next, we have to know about the location and extent of mammary gland. So I would like to firstly write these things and then I will draw a diagram. So if you want to score a better marks in your theory papers, university theory papers, or center examination which is going, or any summative exam which is going on your college, so what you have to do, you have to draw multiple diagrams, which I don't want everybody to draw a very beautiful diagram, but it should be anatomically correct. That is important. It should be anatomically correct so that you can get a better marks in your theory papers. So if I want to tell you about the extent, vertical extent and horizontal. So both we have to know the vertical extent and we have to know about horizontal extent. So vertically, if I talk about mammary gland extent, it extends from second rib to sixth rib. Okay, and horizontally it extends, the mammary gland extend from lateral border of sternum to the mid axillary line. It extends from lateral border of sternum to mid axillary line. Okay, dear students. Now, so this is about the vertical and the horizontal extent. And also if I talk about the shape of mammary gland, it is, most of the cases, it is hemispherical, it is conical, or it can be pendulous. So Three major types of shapes are seen in mammary gland: hemispherical, conical, pendulous. Okay, so these are the shapes of mammary gland. Now next is to know about its important points. So let me just check your messages also in between. So I just see the YouTube session chat box. So yes, okay, any doubt, my dear students, if you're not understanding anything, you can let me know. I also want that everybody should be ready with their colored pencils, okay, HB pencils and pens, so that we can draw the diagram. So now if you want to score better in the exam, that is very important. If you want to have a better marks in exam, so what you want, you have to draw this also, okay. And the mammary gland diagrams are very, very easy. So we will just draw a diagram showing the location and extent of mammary gland. So location and extent, the heading is already written, and we will draw a schematic diagram showing the location and extent. So I'm just drawing an outline. This is upper limb. This is the okay. Then here I want to draw the manubrium sterni. This will be the sternum which I have drawn. Okay, this is the sternum. Okay, now exactly we will draw about, okay, this is the mammary gland which I have drawn. Okay, so here we will have also, I will draw here one rib. Here is the lateral border, no doubt about that, that this is the lateral border which I have drawn. It will be slightly irregular kind of thing. Okay. Okay, now also beneath I will draw a rib. Okay, so actually one more thing is very important. Let me just show you that also. So actually when we are drawing the diagram of the mammary gland, always from the upper superior lateral quadrant of mammary gland, there is an extension that is called as axillary tail of Spence. What is this? Axillary tail of Spence. So we get an idea of its location now, as you can see. Okay, so now I am using just an orange color for showing the mammary gland. Okay. Yeah, we can use the bony structures with gray color. This is the sternum and these are the ribs. Okay. Now, here let me just mark it. So here we are knowing that this is the mammary gland which I have marked. This is mammary gland. And we have also drawn the sternum. So basically this structure which you are seeing is the lateral border of sternum. This is the lateral. Here we have got the lateral border of sternum. That is the extent. So why I have shown you the lateral border here. So why I have shown you the lateral border? So that you can see this is the extent. This is the lateral border and this is showing the extent of mammary gland medially to that of lateral aspect. So in the lateral aspect, I will use another color. So it is extending from the lateral border of the sternum to that of mid axillary line. So here with a red color, I am drawing the mid axillary line. So somewhat here. So let me just draw it nicely. Okay. Okay, this is the red line which I have drawn, and this line is the mid axillary line. Mid axillary line. Okay, now the upper rib, which is the second rib and the lower rib is the sixth rib. So if I want to label it, this is the second rib. Okay, and this is the sixth rib. This is sixth rib. So we have got the extent of mammary gland. It is extending, and this projection which I have made, what is this? This is axillary tail of breast. This is axillary tail of breast or mammary gland. So we have got the medial to lateral extent of mammary gland, that is from lateral border of sternum to the mid axillary line, and superior to inferior extent, which is from the second rib till the level of sixth rib. Is it okay? So done with the location and the extent. Now I would like to talk about relations. So for the relations, I would like to firstly note down the relation, and again we will draw a diagram for it. Okay. In exam, if you have less time, you can just mark the image, you can draw the image, and you can mention the relation there itself. Okay. So the deeper aspect of the breast, if I am talking about the deeper aspect of the mammary gland, it is related to the structures. For a few structures like pectoral fascia, it is related to pectoral fascia, and it is related to the muscles like the pectoralis major muscle, serratus anterior, and external oblique muscle. So mammary gland is located superficial to the pectoral fascia. Study class, we have seen the deep fascia covering the pectoralis major muscle is the pectoral fascia, and we have also seen the muscles in the pectoral region, that is pectoralis major, serratus anterior, and we have seen few origin of pectoralis major from the external oblique muscle also for few fibers. So they all muscles are related in the posterior, in the relation of the mammary gland. These are all on the posterior aspect of mammary gland. So write down relation. So breast or mammary gland is related to following structures on deeper aspect. Got it? So what are these structures? The first structure will be the pectoral fascia. And what is pectoral fascia, my dear students? Know it covers the pectoralis major muscle, which we have already talked in the studies session. So I'm not writing it once again. I think my dear students are knowing. And it is related with three muscles on the deeper aspect. So that means mammary gland is located superficial to pectoral fascia and these three muscles. What is the name of these muscles? So please write down the name of these muscles are pectoralis major, serratus anterior, and external oblique muscle. Got it? So we have got all these structures in the relation. Now actually, if I talk about mammary gland, it is separated from the pectoral fascia by a space which is called as retromammary space. So this space of retromammary space is having loose areolar tissue. So due to the presence of these loose areolar tissue which is separating the mammary gland from the deeper structure, the breast can freely move up and down or to sides or from side to side over the pectoral fascia. So this is the clinical significance of presence of retromammary space. Okay, so we will talk about relation. I will also write down the important key points. So before that, I just want you to draw a diagram. Okay, so let me just check the students. With the students, are they understanding? Yes, Alicia, is it okay? Or have you understood? Any doubt, you can ask me right itself when the session is going on. Okay. Okay, welcome, Aliza. So let's draw a diagram showing deeper relation of the breast. So relations of mammary gland. Here in the bracket, you can write deeper relations. Deeper relations. Okay. So again, I will draw the cut section of the clavicle. As you can see, here a muscle is there. Then again, so let me just use green color for the fascia. So I will use green color for making the fascias. Okay. So this is the clavipectoral fascia. Today's session we have talked about clavipectoral fascia, and my dear students, we are knowing that it encloses two muscles. It encloses two muscles. Now let us shade the muscles with brown color. So the upper muscle will be subclavius and the lower muscle will be pectoralis minor. And this will be the cut section of clavicle. So you can just label it clavicle, subclavius muscle, pectoralis minor muscle, and clavipectoral fascia. In anatomy, to score a good rank, what is required is drawing the diagrams. Subclavius muscle, pectoralis minor muscle. Okay, so done. Now, I will draw a muscle here, the bulky muscle of the pectoral region. What is this? This is pectoralis major muscle. This is the pectoralis major muscle. Done. Now this pectoralis major muscle is covered by pectoral fascia. So it is covered by pectoral fascia. So close to it we will use green color. So I am just close to it we will use a green color to make the pectoral fascia. Is it okay? Okay. If you want, we can thicken this. Okay. So this is the pectoralis major muscle. Going with the labeling. Okay, I will label it, but anterior to the pectoral fascia, we will have retromammary space. Actually, this space is also used and utilized by the surgeons for the implantation of the breast, okay, silicone breast, when the removal of breast is done in case of breast carcinoma. Okay. Now, this is the breast outline. Okay. Now here you can just label it mammary gland. Okay. And here will be the space which I want you to show, this space. Okay. This space will be the retromammary space. So I will use yellow color to highlight the space. This space is the retromammary space. And this part is the mammary gland. Okay, so this is pectoral fascia. Okay, this is the pectoral fascia. This is the breast, which we have already written, no need to write it once more. We can write here that this is the retromammary space. This space is the retromammary space. Okay, so now in this diagram, we can clearly see that the mammary gland is related to deeper aspect. Okay, so this is showing the deeper relation is on the deeper aspect, just deep to the mammary gland is the retromammary space, which is seen here. We can also see the pectoral fascia, and we can also see we have got clavipectoral fascia containing two muscles, that is the subclavius muscle and that of the pectoralis minor muscle. So we have seen this. Now this was actually a lateral aspect and the sections which is appreciating this relation, but I would also like to show you a surface view in which you can also appreciate the three muscles on that three deeper muscle on which the mammary gland is also having the relation and resting. Okay, so let's draw one more diagram. So I want to draw one more diagram, my dear students. So draw another diagram. Okay, just an outline. Okay, here what I am drawing is the manubrium sterni. Got it? Okay, and this structure will be the mammary gland. This structure is the mammary gland. Okay, this is the mammary gland which I have drawn, having an extension called as axillary tail of Spence from the outer superior lateral quadrant. Okay, and the muscle. So the muscles lying deep to it. So, and here we will have also the ribs, outline of the ribs. I just want you to show, just to make you understand. Superiorly we will have the structures. Here we can have the clavicle attached. So this is the clavicle, so that I can show you the attachment of the muscle to this structure. I will just show you the outline. So today's session I have told you, and I have told you that not only the clavicle, but also the anterior aspect of this sternum. So we will also have the anterolateral aspect of sternum, which is giving rise to this muscle, that is the pectoralis major muscle. So this is the fibers of pectoralis major muscle which you are seeing. Okay, now also on the medial aspect we will see few fibers of the serratus anterior muscle, and serratus anterior muscle is, and lower down we can see the external oblique muscle fibers. Okay, so these are three muscles. So I will utilize my brown color to show you the muscles. So these are the fibers of pectoralis major muscle. This is the serratus anterior muscle, and lower down we get the fibers of external oblique muscle aponeurosis. Okay, got it? These are the three muscles which you can see here. So please write on the heading. So a very simple diagram I have drawn. So here, if you want, you can draw here that this is the clavicle. This is the sternum. Okay, and on one side you can write on the heading. And here actually I will use a red color. Okay, this is the, just to make you understand. So I am using again this color to draw the orange color to draw the mammary gland. Okay, done. Okay, now here you can write down the heading muscles related, or you can write muscles deep to breast. The heading is muscle deep to breast. Muscles deep to breast. So we have got three muscles. The first is pectoralis major muscle. Okay, so which is the major muscle? This is the pectoralis major muscle. The second is serratus anterior muscle. So which is serratus anterior muscle? We have got the serrated shape muscle is the serratus anterior muscle. So we will have serratus anterior muscle. And the third muscle will be the external oblique muscle. So write down the third muscle is external oblique muscle. So these three muscles are related on the deeper aspect of the breast. And actually, can you see this red color encircle structure? Actually, that is foramen of Langer, and it's an opening in axillary fascia for the passage of axillary tail of breast. Okay, so this red color structure, so if you want, we can just write here. What is this? This is foramen of Langer, and foramen of Langer is an opening. It's an opening in axillary fascia. It's an opening in axillary fascia for the axillary fascia for the axillary tail of breast. For the axillary tail of breast. Got it? So my dear students, we are now seeing very nicely the muscles related on the deeper aspect of the breast. So till now we have seen the location. So my dear students, are you understanding? Please let me know. Yes. Good evening, Abhishek. Good evening, Lisa, everyone. So yes, till now we are knowing the relations of the breast. We are knowing the pectoralis fascia over which the breast is lying. We are seeing how we have seen two images. So I have drawn two images. This is the surface view showing the pectoral group, showing the muscles which is related on the deeper aspect, pectoralis major, serratus anterior, external oblique muscle. The other image which we have drawn is the showing you the retromammary space and showing the clavipectoral fascia, pectoralis major and retromammary space on the deeper aspect which you have seen. And also in the another image where I have drawn the extent and location of the breast mammary gland. So till now we have done. So we have done this. Now I just want, so basically axillary tail of Spence, and you have to know the note point about axillary tail of Spence, which I have already written, that axillary tail of Spence is passage is actually it is an extension. So it is an extension of mammary gland from suprolateral quadrant, passing through foramen of Langer, which foramen of Langer, which is an opening. So we know that foramen of Langer is an opening. Foramen of Langer is a opening in axillary fascia. It's an opening in axillary fascia. Got it? Yes. So we have done with this. Now also we have to know about the structure. So is it okay, everyone? Have you understood? Now it is also important that we should be knowing about the structure of mammary gland. So next important point is to know the structures of mammary gland. Okay, so basically, okay, one more point was very important, that the breast is separated from the pectoral fascia by a space called as retromammary space, which is filled with loose areolar tissue, and this presence of loose areolar tissue is the basis of breast being mobile. And it can be moved freely up and down and from side to side. This is an important point which you have, noteworthy point which you have to note down. Now, if I talk about the structures of the breast is having following structures. It is having skin, it is having stroma, and it is having parenchyma. So, superficially, we will have the nipple and areola, and we will have the deeper structures in the breast. So, it will have, the breast is having following structures. It will have some of the structures will be located in the skin. So, we will have some of the breast structures which is located in the skin, like we will have the nipple and areola, which will be located in the skin. So we will talk about nipple and areola also. So the first structure is skin, which contains nipple and areola. Then we have to know about the connective tissue stroma and that of parenchyma. So we have to know about the stroma part. And we have to know about the parenchyma, that means glandular tissues of mammary gland. When I am using the word parenchyma, that means glandular tissues of the mammary gland, which you have to know. So parenchyma which contains glandular tissues of mammary gland. Which contains glandular tissues of mammary gland. Okay, done. So now let's also elaborate this. So I just want you to show another image. This is an image of mammary gland in which you can, so in this image you can appreciate that if I am talking about the mammary gland, so basically you can see again in this image that posterior to it we have got ribs, lungs. You can see the pectoralis major muscle covered by pectoral fascia as in the shown in the diagram. And we can see also the ribs are interconnected by intercostal muscles, and we can see the important parts of the mammary gland. You can see the parenchyma, which is the glandular portion, consists of the lactiferous sinus, lactiferous ducts, and the suspensory ligament, which is supporting it is a connective tissue framework which is supporting the mammary gland. Okay, so we can also see the lobules of the mammary gland. It is also the part of the parenchyma of the mammary gland. So actually, whenever the question comes about the structures, actually we will also have discussion of mammary gland in the histology part, but here I will tell you the broad features about the different structures of mammary gland. I would like to tell you about skin. So in the skin, what is the location of nipple and where is the areola lying? Then I will like to tell about the stroma, which contains suspensory ligament of Cooper. Then I will tell you about the glands, lactiferous glands, the sinuses, and milk gland of the mammary of the breast and mammary gland. So let's start with this. So we have to now know in detail about the mammary gland. Okay, so first thing which I want you to describe is the skin. So let me first describe it, then I will draw a diagram for you. Skin. So if I talk about the skin first structure which you should know, actually in the examination and in MCQ so many times it has been asked what is the location of nipple. So basically nipple is a conical projection, and exactly it is corresponding to the level of fourth intercostal space. What is the location? It is residing in fourth intercostal space, and it is present in the center part of mammary gland. So let's write about nipple. It is a conical projection. It is a conical projection below the center of breast, present in fourth intercostal space. So in which intercostal space is the nipple located? In the fourth intercostal space. It is located in fourth intercostal space. Okay. So, and it contains, what does it is made of? It is made of smooth muscle fibers. So this, the nipple part of the mammary gland, it is made of smooth muscle fibers. Which is having rich innervation from nerves. Okay, it is having rich innervation from the nerve. The second part which you have to know is the areola. Actually, the surrounding area to the nipple, it's a circular area of pigmented area which is surrounding the nipple area. So it is surrounding the base of the nipple. Okay, it's surrounding the base of the nipple, and it contains large number of modified sebaceous gland. Okay, these sebaceous gland is present in the outer margin, and actually this sebaceous gland of areola is enlarged during pregnancy, and in that case they are called as Montgomery tubercles. Okay, so this is also asked in MCQ, so you have to know about the areolar areas. So let's write about areola. It is, okay, it is circular area surrounding nipple, surrounding the nipple. It contains modified sebaceous gland. Okay, and exactly it is actually a modified sebaceous gland, and it is if I talk about sebaceous gland, sebaceous glands are holocrine type of gland, and what it secretes oily secretion. So it gives an oily secretion, and what is the function of this oily secretion? The function of these oily secretion is if I'm talking about the function of these oily secretion, what is the function? It lubricates the skin. So it is lubricating the skin. So they produce oily secretions. And importance is these sebaceous gland, these modified sebaceous gland enlarge. Note point: sebaceous gland of areola are enlarged during pregnancy, are enlarged during pregnancy, enlarged during pregnancy, and appears as small nodular projection. So these will appear as pregnancy and is in the form of nodular projection. So they form a nodular projection or elevations, and a particular name is given to this modular projections or elevations. And what is it called as? So this modular projection or elevation is termed as, Montgomery's tubercles. Montgomery's tubercle. Okay. So this can asked in the Viva, or this can be asked as an MCQ session. So two important things which can be asked is one about the location of the nipple, that is fourth intercostal space corresponding, and the Montgomery tubercle. Okay. So we have done with the important things which is seen in the skin. Now the next important part which you have to know is the stroma. So let's talk about the stroma part. So let's talk about the stroma part. Okay. So actually, if I talk about stroma part of the breast and mammary gland, it is made of connective tissues and fat. And these forms the supporting network for the breast. So they are supporting the breast, and the condensation of these tissues are in the form of fibrous strands, and these fibrous strands or septas which supports the breast and mammary gland is called as the Cooper's ligament. So please write down the stroma. The stroma of breast is consist of connective tissue. It consists of connective tissue and fat. Okay, it is consist of connective tissue and fat. Okay. So what is the most important function of this connective tissue framework is the support. So they form supporting framework for the breast. The stroma part of the breast forms a supporting network. So they are forming a supporting network, supporting framework for breast, of the breast. Now, the other important point is the connective tissue is condensing. These connective tissue. So the connective tissue condenses. It condenses to form fibrous strands. So what they will form? They will form fibrous strands or septas, which is increasing the support system of breast or mammary gland, called as suspensory ligament of Cooper's. So connective tissue condenses to form fibrous strands or septas, which is termed as suspensory ligament of Cooper. This has also been asked as so many times in the examination. So this is called as suspensory ligament of Cooper. A very important things which you have to know. Okay. So basically, and if you will see the arrangement of suspensory ligament of Cooper, it is radially arranged, and it is also actually, these are very important structures which is providing strength and giving support to the breast. Okay. So this connects to the dermis of the overlying skin, and to the ducts of the breast, and to the pectoral fascia. So this is how it will support the mammary gland. So what is its role? The suspensory ligament of Cooper, which is arranged in radial pattern, they are connecting the overlying skin. Which part of the overlying skin? The dermis. to the duct of the breast and that of pectoral fascia. So this is how they forms the connection. So suspensory ligament of Cooper connect the dermis and the ducts of breast and pectoral fascia. So this is how it forms a connection supporting the mammary gland. Is it okay? This is how it supports the mammary gland. Okay. Now, basically, and exactly this Cooper's ligament is the structure which is maintaining the shape of the breast. Okay, it is giving, so if the aging breast is there, then the suspensory ligament of Cooper is not so prominent and not so this fibrous strands are not so strong, so that in aging the breast becomes pendulous because of the loss of strength of suspensory ligament of Cooper. Now next we have to talk about the parenchyma. So let's talk about the parenchyma, the most important part of the breast. So yes, we have talked about the stroma, the second part. We have also talked about the skin, the first part. Okay, we have talked about the skin as we have seen here. We have talked about the stroma, and now I want to talk about the parenchyma. The third part is the parenchyma. So parenchyma is the glandular portion of the mammary gland, the most important portion of the mammary gland, which is actually consists of about lobes. Inside the mammary gland, we have got 15 to 20 lobes which are arranged in radial pattern and radial fashion, like the spokes of a wheel, and actually these are all converging towards the nipple. So basically that is each lobe is again divided into lobules. So there are 15 to 20 lobes arranged in radial pattern, and then they are divided into lobules, the smaller unit, and these lobules are connected to the cluster of acini. Each lobe is drained by, if I talk about the lobes, they are drained by lactiferous duct, and the duct from the different lobes will converge towards the nipple. And actually when you will see the lactiferous duct, they expand towards, when they are converging towards the nipple, and the expanded part is called as lactiferous sinus, which is considered to be the reservoir of milk. Okay, that are important point about the parenchyma of the breast. So please write on the important point. Then we will draw a very neat diagram showing the parenchyma and the stroma of the breast, where I will draw a diagram showing the suspensory ligament of Cooper. We will draw the diagram showing the lobes, lobules, the lactiferous duct, the lactiferous sinus of the mammary gland. So parenchyma is which portion? It's the portion, it is made of glandular tissue. That is already known to you. It is made of glandular tissues. So it is made of glandular tissues of the breast, and it is important structure because it secretes milk. Why it is very important? Because it secretes milk. It secretes milk. Done? It secretes milk. Now, important point, it is consist of parenchyma. So the first point is it is consist of about 15 to 20 lobes, and these 15 to 20 lobes are arranged in radial pattern. Okay, in radial pattern or radial fashion, like the wheels of the like the spokes of the wheels, and they converge. All these will converge. They are converging towards nipple. Each lobe is divided into lobules. Second point, each lobes are divided into lobules. Okay, and actually, and this lobules are consist of acinus, a cluster, and these lobules are consist of clusters of acini, and each lobule is drained by, and if I talk about the lobules, they are drained by lactiferous duct. Each lobules are drained by lactiferous duct. Got it, my dear students? Okay. Okay, now the duct from the different lobes are all converging towards the nipple, and they all will appears towards the nipple summit, and near the nipple they will and areola, these ducts will expand to form the lactiferous sinus. Okay, so basically these are important points. So they will all converge towards the nipple area and near their termination. So write down near this duct, near the termination. So if I talk about the lactiferous duct near the termination, so we are talking about the lactiferous duct near the termination. Near the termination, the ducts will expand, and what is it called as when it expands? What is it called as? Lactiferous sinus. It is called as lactiferous sinus. So where it expands is called as lactiferous sinus, and lactiferous sinus are, we can say lactiferous sinus is reservoir of, it acts as a reservoir of milk. It acts as the reservoir of milk. Okay, done. So these are the important points which you have to know. We have done about the parenchyma also. Now we are now knowing about the parenchyma. We are also knowing about the stroma. We are also knowing about the structures, that is we are also knowing about the location of nipple and the areolas, Montgomery tubercles and all. So now I would like to draw a diagram in which I would like to make the lactiferous ducts, lactiferous sinuses, lobes and lobules of the breast and the suspensory ligament of breast. So let's draw a diagram. So before that, you can see this mammary gland. Okay, so before making the diagram, let's see the mammary gland, so you will have a understanding of the structure. So we can see the deeper muscles here. So we can see here, we can see the pectoralis major muscle has been shown, over which the breast is lying. Okay, so let's see here. We can also see the suspensory ligaments. Okay, we can see the suspensory ligaments in between, which is forming the stroma, the adipose tissue, the lobes. So these are all lobes. So we can see the lobes. We can see the areola and the nipple. Here you can see the openings of the duct. So you can see these are the openings of the duct which is shown. All these are the openings of the duct, and can you see here it is enlarged. The openings of ducts are enlarged. So if you will see nicely, or you can have a look on the enlarged part. Can you see these are all ducts? These are all ducts which is converging towards the nipple, and when they are going close to the termination, these are called as lactiferous sinus. What is this called as? These are called as lactiferous sinus. So these are, LS means lactiferous sinuses. They are lactiferous sinus which are reservoir of the milk. Okay. So basically this is the diagram which you have to make. So we will draw a schematic diagram, a simple diagram to make, and we will use green color for the stroma, that is suspensory ligament, and I would like to show you the lobes of the breast and also in between the fat, and we can see the lactiferous duct and the sinuses. So let's draw a diagram. Okay, then I will show you a diagram. Then I will show you another image for the important structures. So for that, let's draw a diagram. So again, I am drawing here the cut part of the clavicle. Okay. Attached to it is the muscle. Covered by pectoral fascia. Covered by pectoral fascia, shown in green color. Okay. Okay. So we will just shade it with gray color, the clavicle, and this is the muscle. This is the pectoralis major muscle. This is the pectoral fascia. Okay, the same outline. Then we should also draw the outline of the breast. Okay. Okay, this is the outline of the breast. Now I will use here to make the lactiferous ducts and all. Okay. Okay. So a dilatation will be made close to the nipple area. A dilatation will be made close to the nipple area like this. Okay. Okay. If you want, we can make one more here. Like this. Okay. So here I would like to use another color for this. So these are lobes. What are these? These will be the lobes of the breast. These are the lobes of the breast. Okay. Here we can, these are the lobes of the breast. Here we can draw the lactiferous sinus and the ducts. So we'll have the lactiferous sinuses. Okay. Now we can also use another color for the whole of the breast outline. Okay. If you want to draw, then you can see the retromammary space. Retromammary space. This can be drawn via like this. This will be the retromammary space. Okay. Done. Now I will use green color only to show the Cooper's ligament. So in between we will have the strands of Cooper's ligament running. So we'll have the strands of Cooper's ligament supporting and running. Okay. So now let's do the labeling part. So these are all, let me use black color. These are all lobes of breast. Okay. So these are all lobes of breast. If you want to label, so you can write down as this image as mammary gland. Image which is showing mammary gland image. This is a mammary gland image which is showing the stroma and the parenchyma. Okay. Okay, dears. So what is exactly shown all the things? So we can just these are the clavicle. This is the clavicle. This is the pectoralis major muscle. These are the similar things which you have seen. This is pectoral fascia. This is retromammary space. This space is the retromammary space. Okay, so these are all the outlines. These are all outlines of the structures which is shown here. And talking about the parenchyma. So parenchyma ke liye humne lobes, we have made the lobes. As you can see, we have made the lobes here in the parenchyma. Okay, in the parenchyma, we have made the lobes. Also here we can see the lactiferous sinus and duct. So we will have this lactiferous sinus and duct. So see here, let me just... lactiferous sinus and duct. So these are lactiferous ducts. These elevated part, rounded structures are lactiferous sinus. These are lactiferous sinus. Okay. And so we can see the lactiferous sinus, we can see the lactiferous ducts, we can see the lobes of the breast, and the very important structure which is the supporting network in green color inside the breast, supporting the parenchyma of the breast, is the Cooper's ligaments. That is ligament of Cooper. That is ligament of Cooper. So done. So this is a very easy schematic diagram which you will draw. This is a very easy schematic diagram which you will draw in your university paper to explain the structure of the breast. Okay. If it comes as a histology question, then you have to use your H&E pencils and draw the parenchyma and the stroma. Okay. So that will be a separate session in the histology part. Now we are now knowing about the relations, location, extent, structures of the breast. What else? Now we have to know about the arterial supply, venous drainage, and the lymphatic drainage, and clinical anatomy of mammary gland. So done with this. Now before that, okay. So before that, can I have a small quiz like a thing with you? So that is identification of the structure. So all of you are seeing this image. So I just want everyone. So let me just check with the messages also. Are they understanding? Ma'am, Mudit is telling, Mudit Gupta, ma'am, we want the PDFs. Okay, so okay, sure dear, you can have the PDF also. And you can contact the PrepLadder team for the PDFs also. Okay, now, so basically, okay, for once more, as Mudit Gupta told me once more, so don't worry. For proper understanding, once again, I'm showing you the structures in this mammary gland image, where we are going to identify the structure. So please focus on this image and know the important structure. So basically here you can see first, second, third, fourth, 5, 6, 7, 8 are marked. So this is the cross section of, what is this image? This is the cross section of human mammary gland. So what is this image? So I would like to label it here. This is the image which is, let me write it. This image is showing cross section of, this image is showing cross section of human mammary gland. Human mammary gland. Okay, this is the image where you can see the cross section of human mammary gland. Okay, now you can see the cross section of human mammary gland. Done. Now let's see one by one the structure. So here, what is one? Any idea what is one actually? How you can identify one? You can see the cut sections of the ribs are there. Can you see? These are what? These are the ribs which is cut. These are the ribs which has been in the cross section it has been cut. So that means one will be the area of chest wall. I am writing it just the chest wall because we have not covered the thorax gross anatomy. So you just understand it is a chest wall which will contain the intercostal muscles and all. And the second important muscle which you are seeing, which you are knowing, because I have covered the pectoral region. So this you are knowing. What is this muscle? I think you can identify Any guesses? Any guesses, my dear students? So what is this muscle? This muscle is pectoralis major muscle. This is pectoralis major muscle. Okay. Now coming to the third important identification. You can see these are consist of lobules which is converging towards the nipple area. So this is lobules. Okay. Now, so the fourth area is nipple. Any guesses for the fifth area? You can see the nipple base is surrounded by darkened structure of the skin, which is the part of the skin. Any guesses? It is areola. Okay, very good. And my dear, what is six? What is the sixth structure? That is the ducts with some elevation. So some dilatation. So that is the milk duct. So that is the milk duct, lactiferous duct. And we will have the fatty tissue as the 7 yellow color structures, fatty tissue. And what is 8? Nothing. That is skin. What is it? That is the skin. Okay. So we can see important structures in this cross section, which you have to identify. Okay. Now, the next thing is, so till now we are knowing the structures. We are knowing about the identification of these structures. What else? In the next part, a very important point which you have to know is about the nerve supply, blood supply, and the venous drainage and lymphatic drainage of the breast. So that is very, very important. So let's start with the arterial supply. So let's start with that. Okay. So let's see. Okay. So let me just write the, so firstly, I will write about arterial. Whenever the question comes about blood supply of mammary gland, what you have to do? You have to explain the arterial supply. You have to explain the venous drainage, both. Okay. So in many questions of anatomy, the question is generally mentioned as blood supply. So you have to not skip the venous drainage. Both you have to mention. So let's first know about the arterial supply. Is it okay? Firstly, we will know about the arterial supply. Okay. So arterial supply and venous drainage I will write and then I will explain it. Okay. So if I talk about the breast mammary gland, it's a highly vascular structure. So write down arterial supply of mammary gland, and the arterial supply is via following arteries, so please mention it. The important artery is the mammary artery, which is also called as internal thoracic artery. Actually, these internal thoracic arteries, which are called as mammary arteries, and its branches, that is the second, third, and fourth arteries, perforating branches will pierce and which give arterial supply. Also the branches of axillary artery, also the branches of posterior intercostal artery. So these are primary arteries which is giving blood supply to the breast. So the first source will be of internal thoracic artery. Okay. Now, what is the other name of internal thoracic artery? It is also called as mammary artery. A major source of arterial supply comes from this artery. Okay. So they supply through perforating branches, which is actually traversing through second, third, and fourth intercostal spaces. So they will supply arterial supply via perforating branches, mainly in which intercostal space? Second, third, and fourth intercostal space. ICS. What is it? Fourth intercostal space. The second artery of the second important is axillary artery. Axillary artery. Axillary artery will supply the mammary gland via its branch, that is from the second part of axillary artery, that is lateral thoracic artery. What is it? So via lateral thoracic artery, it gives branches. It also gives branches via acromiothoracic artery branches and superior thoracic artery. So axillary artery, 3 branches can be, is the source of arterial supply to the mammary gland. So one of the main sources is the lateral thoracic artery. The other will be the acromiothoracic artery. and the other is also via superior branches, superior thoracic artery, also via superior thoracic artery. So my dear students, in the axilla part, I will tell you that lateral thoracic, acromiothoracic artery are the branches from the second part of axillary artery. And if I talk about supreme thoracic artery being the branch from the first part of axillary artery. And the third source is posterior intercostal arteries, which via lateral branches give blood supply to the breast. So the third source is posterior intercostal artery. Got it? So this branches through the lateral branches, mainly through lateral branches. So we have done with the important source of arterial supply, and you have to, you have to just mention it. Okay, so basically we have made many diagrams, we have already covered many diagrams, so you can just mention this source whenever it is asked. So you can just mention this source. This is showing you the arterial supply of mammary gland. Then now we will see the next is to know the venous drainage. So please write down about venous drainage also, then one by one I will explain it. So basically, if you I will show you the image also. Please firstly complete this, write down venous drainage. So venous drainage of mammary gland. So actually, if I talk about important veins which is draining the mammary gland, which will be corresponding to the arteries name like axillary vein, internal thoracic vein, and posterior intercostal vein. So that means the arteries, the veins follows the arteries. So we have got three important veins which is draining blood to the breast. So what are they? Axillary vein, internal thoracic vein, posterior intercostal vein. Posterior intercostal vein. Okay. So actually the veins will follow the arteries. So basically these are very important point which you have to know. And actually if I am talking about the veins, they will converge towards the nipple and they will form an anastomotic venous circle. And then they are actually arranged in the form of superficial and deep set of veins. Superficial veins will drain into internal thoracic vein. As you can, you have seen, I have mentioned internal thoracic vein. And if I am talking about the deeper veins, they will drain into axillary and posterior intercostal veins. So this is how. So if you want, you can write down superficial veins drains into internal thoracic vein, okay, this will drain into internal thoracic vein. Deep veins, so these veins are in the form of anastomotic venous circle. Deep veins drains into so basically if I talk about deep veins, they also drains, actually they will drain into, again they will also form a network and they can drain into internal thoracic. They will drain into the axillary and posterior intercostal vein. So both. So basically they will also, few will go to internal thoracic vein also via superficial deep, and to axillary vein and to the posterior intercostal veins. Okay, so these are all drainage. Okay, now it's important that we should be knowing that breast cancer, how it spreads. So basically cancer cells, one of an important point about the spread of the cancers, I want you to know about the clinical correlation. So you can write down metastasis metastasis of breast cancers So how the breast cancers reaches the brain. So metastasis of breast cancer to brain. So how it occurs, that you have to know, the route you have to know. In brief, I will tell you the route. Okay, so everyone please note down. In brief, I will tell you the route. Cancer cells from breast, cancer cells from the breast will drain into posterior intercostal vein. Intercostal vein. Is it okay? IC means intercostal veins. And thereafter, they will also form communication with vertebral venous plexus. And this vertebral venous plexus will drain into intracranial dural venous sinuses. And intracranial dural venous sinuses will drain the breast cancer cells to brain. This will go into intracranial dural venous sinuses. And my dear, this is an important route. So this is an important route via which it will be ultimately draining into. This is an important route that it will be draining into brain. Is it okay? So you have to know this spread. You have to know this spread. Now basically, so this communication of posterior intercostal vein, azygous vein, internal vertebral venous plexus, and its communication, this is an important route of communication and spread of malignancy which happens via this route to the brain, to the vertebrae, to the ribs and the skull. So this is a very noteworthy point which you have to note down, and then I will also draw a diagram showing the venous drainage of mammary gland. Okay, so this is a very important point. Before that, you can just see this image where you can appreciate the arterial supply of mammary gland. So you can see the branches of axillary artery, that is lateral thoracic artery as a branches, thoracoacromial artery. Also we have got internal mammary artery, perforating branches, and intercostal arteries. All these are arterial source or the blood source, arterial source of mammary gland, which we have already written. Okay, so arterial supply of mammary gland is already done. Now venous drainage, as I told you, so I will draw a diagram for it. Before that, I just want you to write a note point about the venous drainage, everyone. So write a clinical point about the venous drainage, everybody. And I have also given you the flow chart by which the communication of or the spread of cancers, malignant cells metastasize from the posterior intercostal vein and reaches the brain, which we have done. So one of the note point is, okay, this is a very important note point. Communication via posterior intercostal vein azygous vein. Actually, when I will take the class of thorax and in the intercostal space, I will show you how posterior intercostal vein drains into azygous vein. So, and internal vertebral venous plexus. These are communicating, and these will communicate with transverse and sagittal sinus. So basically, if I talk about the communication which is happening via, so basically if I am talking about the communication via these important, so basically we are talking about communication which is happening, which is an important source of communication which we are seeing here, which is happening via these important source of vein, and this will form communication. So this will form communication to transverse, sagittal sinuses and spread malignancy to, and spread malignant cells or malignancy, spread malignancy to abdominal organ. This forms an important spread. This forms an important source of spread of malignancy or malignant cells to abdominal organ, to abdominal organ, to the brain, to the vertebrae, ribs, also to the ribs, and to the skulls, and also to the skulls. Okay, so these are important source of infections. These are important mode. So venous drainage says spread of infection can happen, and the malignant cell can form communication via the intercostal veins, posterior intercostal veins, azygous vein, internal vertebral venous plexus, and ultimately reach the brain also, which we have already known about the root. So my dear students, if you have got any doubt, please let me know. Okay, so I am writing everything. So my dear students, I am writing everything and making diagram, and I am doing this at a pace in which you can clearly do this. You can clearly be at a same pace like me. I'm not going very fast, I think. Okay, Mudit Gupta, if you pay attention, you can copy along with me. Okay, so that will be easy for you. Now let's draw an image. So let's now draw an image of venous drainage of mammary gland. Okay, venous drainage of mammary gland. Then I will also show you an image of that. So let's draw an image of venous drainage of mammary gland. Okay. So for that, I will first draw an outline of mammary gland. Here I will use a blue color to draw the venous plexus. Okay. Now I will draw here an outline of the vertebra. So this is vertebra. Just an outline. And the various roots. So I will surround it with various veins so that you can understand how it is reaching to various veins and how it is spreading. Is it okay? So let's make few outlines. Okay. Okay. Okay, so this vein which I have made is azygous vein, and this is the posterior intercostal vein which I have made. If you want, you can make azygous vein slightly big also. Azygous vein. Okay. So I will interconnect, don't worry. And here one important vein, that is internal thoracic vein, which I have made. Internal thoracic vein. Okay. And here axillary vein. Okay. So let's use blue color for the veins. So this is the axillary vein. This will be the posterior intercostal vein. This will be internal thoracic vein. This will be the axillary. This will be the axillary vein. This will be the azygous vein, and the so basically we will label it now. Now we will label it. Okay, so this is azygous vein. Okay, this is posterior intercostal vein. Intercostal vein. This is internal thoracic vein. Okay, dear, this is internal thoracic vein, and this is azygous vein. This is axillary vein. Sorry, this is axillary vein. Okay. Now let's use a blue color showing the communication. So let's use a blue color showing the communication. So very nicely we can see the communications. Here is the communications. Here is Here is the communications. Here is the communications. Here is the communications. Here is the communications. And here is also the communication. Okay. So all these communications has been shown to you. Now, let's also. So this is how it is communicating with various structures. Okay. So I'm just showing you the route of communications. Got it? So here, let me label it now. So here we can see actually, and this is what, this is the circular venous channel, circular venous anastomosis, venosus, circulus venosus. Okay, and you can see this is showing you communication which happens to the internal thorax. So what you can see, this communication, so you can clearly see, if I'm talking about this communication is happening via internal thoracic vein. Okay, you can see the communication, important source of communication is happening to that of, as you can see, let me just okay, so okay, this communication is actually, if you will see, this communication is in the following important direction. So one is internal thoracic vein, one is the via posterior intercostal vein, and that of, so if you are getting confused with this circle, you can remove it. Okay. So, or either you can use an arrow. So the important communication. So this is an important communication which I want to show you with an arrow. So this is how the communication is happening via posterior intercostal vein going to azygous vein and then communicating. What is this dear? This is internal vertebral venous plexus. So this is communicating to internal vertebral venous plexus. Internal vertebral venous plexus. This is the route how it reaches to the brain. And the other one here, we can see again the communications which is happening via internal thoracic vein. Okay, and also here we can see the communication to the axillary vein. Done? All these are very, very important. So basically, if you draw this diagram when you are writing the university papers, you will get an extra marks because you are showing the venous drainage of mammary gland and also showing the communication via posterior intercostal vein, azygous vein, and to the internal vertebral venous plexus, and how it spread to the axillary vein and internal thoracic vein. These are the important source of communication and spread of the cancer cells. Now we have now completed about arterial supply, we have completed the venous drainage, and now next we have to know about the nerve supply, and then we will study about the lymphatic drainage. Lymphatic drainage separately also comes in exam. So all of you, please let me know. Okay, now let's draw another images, that is nerve supply. So now the next thing which I want you to explain is the nerve supply. So basically, if I talk about the nerve supply, the breast is primarily somatosensory. Innervation is derived from second, third, fourth, fifth, sixth intercostal nerves, and that via anterior and that of lateral cutaneous nerve. So this is an important source. The nerve supply of the mammary gland is primarily somatosensory, and it is mainly derived from second to sixth intercostal nerves, and these intercostal nerves will give innervation via its branches, that is anterior and lateral cutaneous branches. So this is how the innervation happens. But exactly if I talk about the most important function of mammary gland is secretion of milk. So basically secretion of milk की बात करें, if we are talking about secretion of milk, it is not under neuronal control, but it is under prolactin hormone. So this is a noteworthy point. So nerve supply is not a very important point for the mammary gland because it is controlled by prolactin hormone. Okay, so the secretion of milk, the secretion of milk from breast, the secretion of milk from breast is not under neuronal control, but by prolactin hormone. Prolactin hormone. It is controlled by which hormone, my dear students? It is controlled by prolactin hormone. Prolactin hormone. Okay. So, and prolactin hormone is secreted by pituitary gland. It is secreted by pituitary gland. Okay. This is an important point. Now, we have to study much more detail about the lymphatic drainage, which separately also comes for examination. So, we have to know lymphatic drainage of breast very nicely. Okay. So, let's talk about lymphatic drainage of breast. So, basically, if I talk about lymphatic drainage of breast, it is actually drained by following important lymph node group, that is axillary lymph node group, internal mammary lymph node group, posterior intercostal lymph nodes, and also deltopectoral lymph nodes. So basically, before going into details how the whole breast is divided into 4 quadrants and how lymphatic drainage happens, and what is the superficial deep group, how the spread happens to the different organs, I would like to just firstly tell you about the broad lymph nodes, in which is an important source of lymph drainage from the breast. So lymph from the breast is drained by following group of lymph nodes. Lymphatic drainage of mammary gland is drained by following group of lymph nodes. Okay, what are it? So it is the important one, please write down: axillary lymph nodes. We have got the axillary lymph node as an important source. Axillary lymph node is there. If I talk about axillary lymph node in this category also, actually axillary lymph node details we will also study in the tomorrow's session when I will describe the axilla. Now here, if I just want to know if axillary lymph node is divided into 5 primary group of lymph nodes, but in axillary group, which lymph nodes are actually the important source of lymphatic drainage from the breast? So in that category, we have got anterior, which is also called pectoral group. We have got posterior, we have got central groups, and the lateral groups. Okay, so they are drained via anterior, the pectoral group mainly, the posterior, the central, and lateral. Then they all will go into apical group of axillary lymph node. So the second source will be the internal mammary lymph node. And if I talk about internal mammary lymph node, they are located along internal mammary vein, thoracic vein. So internal mammary nodes, if I talk about, so they are lying along internal thoracic vessel. They are located along internal. They are located close to the internal thoracic vein, thoracic vessels or veins. Supraclavicular lymph node, which is located above the clavicle. Supraclavicular lymph nodes located above the clavicle. Also in the posterior intercostal lymph node, posterior intercostal lymph nodes. Okay, if I talk about posterior intercostal lymph nodes, they are actually located in intercostal spaces. And the fifth source of the important lymph nodes are, if I talk about fifth source of important lymph nodes, they are cephalic or the deltopectoral lymph node. Deltopectoral nodes, which is lying in the deltopectoral groove. Okay, these are located in the deltopectoral groove. So these are the important source of the lymphatics. Other than that, in addition to this above mentioned major source of lymphatic drainage, the lymph will also drain into subdiaphragmatic and that of subperitoneal lymph plexus. So you can just write down two more. You can write down a sign of plus because they are the most major source. But other than that, lymphatics will be also drained to from the breast. It can also drain to sixth source, subdiaphragmatic, and subperitoneal lymph plexus. Okay, subdiaphragmatic and subperitoneal lymph plexus. So done with this. Now we have done with this. Now we have to just so actually, for proper understanding of lymphatic drainage, I would like to give you a detail. Actually, I will also draw a diagram. So I just want you to know that if I am talking about the breast lymphatic drainage, the mammary gland lymphatic drainage, it can be grouped as superficial and deep. Okay, so it is grouped in to superficial and deep. Superficial will drain. So superficial lymphatics will drain the skin except that of the nipple and areola. And if I talk about the deep lymphatics, that will drain the parenchyma and that of nipple and areola part. So that is an important point. So let's write it more about the lymphatic drainage of mammary gland. Okay. So the lymphatic drainage of mammary gland can be divided into superficial and deep. Superficial will be divided as superficial lymphatics and the deep lymphatics. Will be divided as superficial and deep lymphatics. Now we have to know which is draining into superficial lymphatics and which group is which structures will be drained by superficial lymphatics and which structure of the mammary gland will be drained by deep lymphatics. So right now, first, superficial lymphatics drains the skin, and in the session I have told you, in the skin part of the mammary gland we have got nipple and areola. So here nipple and areola part will be not drained by superficial lymphatic. Rest all the skin area of the mammary gland will be drained by superficial lymphatics. So superficial lymphatics drains the skin of breast except nipple and areola. Except nipple and areola. Got it? The second point. Now we will talk about deep lymphatics. Deep lymphatics. Now, if I talk about deep lymphatics, this deep lymphatics will drain the parenchyma. So they will drain the parenchyma. They will drain the parenchyma of the breast and nipple and areola, and also the nipple and areola. Okay, this is important for you to note down. Actually, a plexus of lymph vessels lie deep to areola, and this plexus of lymph vessels which lie deep to areola is given the name that is called as subareolar plexus of Sappe. Okay, so this is very important, and this has been asked in the MCQ also, that a plexus of lymph vessels located deep to areola deep to areola is termed as subareolar plexus of Sappi. Subareolar plexus of Sappi. Okay, so this is a very, very important source of the lymphatic drainage which you have to know. I'm just outlining this. Is it okay? Okay, this is a very important source which you have to know. That is the subareolar plexus of Sappi. I just want you to highlight this because this is an important point. Everybody should know this. This is subareolar plexus of Sappi. And I would like to show you this image also where you can appreciate the structure. Okay. So subareolar plexus of the lymph of the breast is actually draining. If I talk about its drainage, it is draining into anterior axillary group of lymph nodes. So that is an important. This plexus, that is subareolar plexus of Sappi, is draining the lymphatics from the breast into anterior group of axillary lymph nodes. So where it drains? The lymphatics from this area via subareolar plexus of Sappi will drain into anterior group of axillary lymph node. Okay, so this is very, very important for you to note down. Into anterior group of axillary lymph node. Done? Now. So now I will also actually, it's very important, and if you can also show a diagram showing this important points which I have explained you. So you can just draw a diagram for it. A very easy diagram can be drawn here. Now again, I am going to draw breast outline. Okay, not a complete circle I have made. So this is the breast. Okay, now here the axillary tail of spines will be also made. Okay. I will use green color to show subareolar plexus of Sappi. Okay. And here we will draw some of the lymphatics. This will having the lymphatics like this. So again, we can use green color to show the drainage. As you can see here. Okay. So actually, let's label it. So this is anterior group of axillary lymph node. This is anterior group of axillary lymph node. Okay, this is the nipple which has been drawn. This is the nipple. And this is subareolar plexus of Sappi. This is subareolar plexus of Sappi. So in this diagram, it is quite clear that subareolar plexus of Sappi is draining to anterior group of axillary lymph node. So this is showing you the anterior axillary group of lymph node is receiving the subareolar plexus of Sappi. Okay, this is what we have written also, and I want you to explain also. Now, so we will have further description, but I just want you to show you this image also. And this is showing you the lymphatic drainage of the breast. So here you can see this area. So this area is the subareolar plexus of Sappi. You can see here, this is the subareolar plexus of Sappi, and the lymphatics in which it will drain is the pectoral group. It is the pectoral group. Pectoral means, what is pectoral, my dear students? Pectoral means the anterior group. So pectoral group means the anterior group which is drained here. Subareolar plexus of Sapin. And other than that, we have got many other lymphatics which is surrounding and draining the breast gland. So we will talk about that. So now after this, let's also know the details. So basically, I just want you to, firstly I will explain and then I will draw a diagram dividing the mammary gland into 4 quadrants and how the lymphatics from different quadrants reach to which group of axillary lymph node and how it traverses to the subdiaphragmatic or subperitoneal lymph vessels and reaches to ovary also. That also I will tell you. So let's go in the details. Okay, so let's start with this lymphatic drainage of mammary gland. Okay, so basically if I am talking about lymphatic drainage of mammary gland, so we have to know this via dividing the so we can divide the whole of the mammary gland into 4 important quadrants. So the first important, so few important points we have to know before making a diagram. So basically if I am talking about lymphatics, the lymph from the lateral quadrant of the breast. So basically, if I'm talking about the lateral quadrant of the breast, lymphatics drain into anterior or pectoral group of lymph nodes. Okay. So the lymph, that is an important point which everybody should understand. So that is an important point. Then I will also draw another diagram. So basically, few important points we can write down. The lymph from lateral quadrant of breast, obviously we are talking on mammary gland, will drain into anterior or pectoral axillary lymph node. Pectoral axillary lymph nodes. Got it? Okay. Second, the lymph from medial quadrant. The lymph from medial quadrants. Okay. So it will drain into internal mammary lymph nodes. Internal mammary lymph nodes. Okay. Actually, one of the important point here I want to know, tell you that some will communicate. So that is, if I am talking about some lymphatics will go to the other side internal mammary lymph node also. And in this case, some lymphatics goes to some lymphatics may go to opposite side also. What is this? That means cancers of one breast can become bilateral because of this. Few lymph vessels from the lower quadrant of the breast will follow the posterior intercostal arteries and will drain into posterior intercostal lymph nodes. So few lymph vessels from lower quadrant, okay, from lower quadrant of breast will follow posterior intercostal arteries. Okay, will follow the posterior intercostal arteries and will drain into posterior intercostal lymph node. Drains into posterior intercostal lymph nodes. Okay, these are all very important points for the lymphatic drain. Okay, now if I am talking about the lower medial quadrant, so these are the important points about the drainage. If I am just talking on one more point here, I want to mention, if I am talking about the lower medial quadrant, okay, so we can use an another page for the details. So let's, these are the 3 points. Two more points I want you to know about the lymphatic drainage. So please write down. Fourth point. Few lymph vessels from lower medial quadrant of the breast, from lower medial quadrant of the breast, pierces anterior abdominal wall. They will pierce the anterior abdominal wall and can communicate with subdiaphragmatic and subperitoneal lymph plexus. Can communicate to subdiaphragmatic and subperitoneal lymph plexus Okay, now the fifth point. So exactly, if I talk about the important lymphatic, so the lymph vessels from the deeper aspect of the mammary gland can pierce the pectoralis minor muscle and the clavipectoral fascia to also drain into the apical group of axillary lymph nodes. So few lymph vessels, the lymph vessels from deeper aspect of breast can pierce pectoralis minor and clavipectoral fascia and can drain lymphatics too, and they can reach to the apical group of axillary lymph nodes. Okay, so these are very important source of lymphatic drainage which you have to know. Okay, so these are very important source of lymphatic drainage which you have to know. And other than that, I would like to make a diagram for it. So this is a simple schematic diagram which you have to draw. You can just write on the points, or if less time is there in the university paper, you can just make this diagram. So let's draw a diagram for it. Okay, so please. So let's draw a diagram showing the basically this diagram is showing the mode of lymphatic drainage of breast. So heading will be mode of lymphatic drainage of breast. Okay, dear. So actually this is a very important question, not only for long, for short notes also. So either there can be a direct short notes which can be asked for the okay, Kiran Kumar, ma'am, please give diagram for it. Okay, which one, dear? Okay, diagram. Yeah, so many of the diagrams are there, which I have made multiple diagrams. Okay, I just want my dear students who are live, be prepared with color pencils, notebook, and draw diagrams along with me. Okay, so which all diagrams are very important. I will give you the diagram. So like lymphatic drainage also, you have to make a proper diagram for showing the lymphatic drainage, how the mammary gland is divided into 4 quadrants and how the lymphatic is draining into different group of lymph nodes. Okay, so let's draw a diagram. Sure. Okay, so again I will draw an outline showing the lymphatic drainage. So here now I'm not doing the breast, I'm just showing the dotted lines like this. Okay, now I will draw the breast. Okay. Then I will make it a 4 quadrants. What are this? These are 4 quadrants. So you can mention UM, upper medial quadrant, UL, upper lateral quadrant, LL, lower lateral, LM means lower medial quadrant. Is it okay? So this is how we are making this. So this is the outline of the breast which has been drawn. And it is divided into 4 quadrants. Is it okay? It is how it is divided into 4 quadrants. Now I will use this green color for showing the lymphatics. This is the internal mammary lymph nodes. Of either side I am drawing, because I have told you one side lymphatic will be drained by the other side also. So these are the internal mammary lymph nodes. Okay. Now, here I can draw the outline of clavicle also. Okay. So this will be the apical group of lymph nodes, apical axillary group of lymph nodes. Then we will have also the deltopectoral here. Then we can have here the central lymph nodes. So you can make, just a minute, we can make the clavicle slightly above because I want space here. Okay. Okay. Just a minute. All of you can actually, this is a schematic diagram just to make you understand. So you can just make this diagram. Actually, so many important structures I have to show. So I want a certain space here. Okay. So I'm just making it slightly above. Okay. Like this. Why? Because I want to show important structures here. So I'm just drawing it like this. Is it okay? Okay. Now, the lymphatics, the deltopectoral, this is the, we have got the apical, the deltopectoral, we have got the central, and also we have got the anterior and posterior will be draining into it. No, so we will just, I will draw the anterior and posterior lymph node. I will label it. This is the lateral. Okay. Then there will be posterior intercostal lymph nodes also drained. Okay. And below it, there will be subperitoneal plexus of vein. Okay. And lower down, there will be also communication to the ovary, that is Crookenbeck tumors. Okay. So I will just draw this. What is this? This is the ovary. Okay. And this finger-like structure is the fimbria of the fallopian tube. What is this? These are the fimbrias of the fallopian tube. So this is ovary. Okay. Now. Okay, so now let's, I will use red color for showing the pathways and all. So let me just firstly encircle all these group of lymphatics. This is the group, this is the group, this is the group, these are the groups. Okay, done. Now we will use red color arrows to mark it. We will use red color arrow to mark the drainage. So we can, I just want you to show from the lateral. I have told you lateral part of the breast, lymphatics will drain into, okay, firstly, let me label it firstly. Okay, so labeling is very, very important. So these are, okay, for labeling, we can just decrease the thickness of this. So these are internal mammary lymph node. Internal mammary lymph node. Is it okay? Now we will have here. So let's label it. We will have the apical group of, so this is what this is. Apical axillary lymph node, apical group of axillary lymph nodes. This is the, then we will have deltopectoral lymph node. This is deltopectoral lymph node. Then this is the central lymph node. This is the lateral lymph node. And this is the A and this is P. This is A and P. So what is A? A means anterior. So here I am writing A is anterior axillary lymph node and P is posterior axillary lymph node. And this lymph node is the posterior intercostal lymph node. This is posterior intercostal lymph node. Got it? Now let's draw a red color I will use to show the arrows and how the lymphatic drainage happens. So as I have told you that from the lateral, so from the whole of the lateral, so this you can draw a diagram. So here we will have arrows like this. Also from the lower part, also few will go towards the lower, from the lower lateral quadrant, few will go to the posterior intercostal lymph node. So you can see from the lateral part, the lymphatic drainage is mainly going towards the anterior, and from the lower part, it can also go to the posterior group of, in the posterior group of axillary lymph node. Now from this, it will reach to the central. So where it is going, then it will go to the central. From here, it will go to the deltopectoral, and then it will go to the apical, as you can see here. Okay. And also from the medial quadrant, upper and lower medial quadrant, it is going towards the internal mammary. So few will cross also, as you can see, few will cross also. Okay. And from the lower medial quadrant, the lymphatics will go here. What are this? This is the subperitoneal lymph plexus. So we have to label it also. What is this? This is subperitoneal lymph plexus. Subperitoneal lymph plexus. And from here, it will traverse to ovary. It can reach to ovary, as you can see. Okay. And this is the this is how the dissemination and spread of breast carcinoma cancers reaches ovary, causing Krukenberg, causing the pathway for the spread of Krukenberg tumors. Krukenberg's tumor. Is it okay? So this is how the spread happens. So very nicely, we have completed this image also, and this diagram is a very important diagram. Actually, separately also it can be asked in the examination. So you have to know about the mode of lymphatic drainage of breast in much detail. So we have finished this. Now, actually, after that, I just want to summarize. Actually, lymphatic drainage of breast, I have explained in much more detail. And if you want to just know the crux point of the lymphatic drainage, you have to remember 3 points. 70% of the parenchyma drains into axillary lymph node, 25% of the parenchyma drains into internal mammary, and only 5% of the parenchyma drains into posterior intercostal lymph nodes. So please write on this point. This is a very important point. Important lymphatic drainage. So we have already made a diagram, but here you can see deltopectoral groups. We have got the central group of axillary lymph node, the mammary, we can see pectoral. All these are the lymphatic drainage for the mammary gland, which I have talked. So basically, if I want to just give the summary of lymphatic drainage, so you can write on summary of lymphatic drainage of breast. Summary for the lymphatic drainage of breast. Summary for the lymphatic drainage of breast. So just to summarize the important points, you can just write 75% of the parenchyma drains into, 25% of the parenchyma drains where, and the remaining 5% of the parenchyma drains where. Okay, where is this parenchyma word gone? Okay, just let me write it. Okay, so write it. 70% of the parenchyma lymphatics drains goes to the axillary lymph node. Okay, my dear, and if I talk about 25% of the parenchyma lymphatics drains into internal mammary lymph node. And only 5% of the parenchyma lymphatics will drain into posterior intercostal lymph nodes, which is located along posterior intercostal lymph veins. So it will drain into posterior intercostal lymph nodes. Done. So we have finished a very important topic, that is mammary gland. Now I also want you to know about the clinical anatomy. So we have talked about gross anatomy in much more detail. What is next is to know about the clinical anatomy. So let's go into the clinical anatomy. So let's discuss the mammary gland applied. So yes, my dear students, we have finished about we have finished about the discussion of mammary gland gross anatomy. I have told you about the location, about the extent, about the posterior relations, retromammary space structures, the parenchyma, the Cooper's ligament. Also, I have talked about the lobules, lobes, lactiferous duct, lactiferous sinus, the Montgomery tubercles. We have talked about the lymphatic drainage, arterial supply, venous drainage, and how the lymphatics spread to the ovary, forming Krukenberg tumor. We have also knowing how the spread of cancer cells of the breast cancers, mammary gland cancers reaches the brain. So all this we have done. Now what remains is the applied anatomy. So let me just summarize all important applied anatomy. One of the applied is, which is very important, is that of breast carcinoma. So let's talk about breast carcinoma. So basically breast carcinomas are one of the leading cancers and death in the females. So it is actually one of the leading common cancers, which is quite common in the females, and it arises. So major source is that it arises from the lactiferous duct. So from the epithelial cells of lactiferous duct. So it arises from epithelial cells of lactiferous duct. It arises from epithelial cells of lactiferous duct. And it is most commonly the age group which is affected is 40 to 60 years of age, and basically more commonly in 60% of the cases the involvement is seen in upper lateral quadrant of the breast. So basically if we see 60 to 70% of the cases, we can see the involvement is there in the upper lateral quadrant of breast. Okay, my dear students, now I would like to tell about the breast carcinoma clinical features, what you will see, okay, what we will find in the patient if the patient is suffering from breast carcinoma. So I just want everybody to see this is a case of inflammatory breast carcinoma, okay. So, and you can see the appearance here is the orange peel appearance also. Actually, I will tell you the reason of orange peel appearance and the other reasons of the clinical features, sign and symptoms which is seen in the case of breast carcinoma cases. So this is a case of breast carcinoma where we can see the inflammatory breast carcinoma, presence of hard lump will be there, and the breast will become, the lump will be immobile, okay. It is not readily movable. If you will see the breast, it is readily movable up and down and to the sideways because of the presence of retromammary space which lies between the breast and the pectoral fascia, which we already know. And also we can see the breast has become fixed and immobile. What is the reason why it is fixed and immobile? Because of infiltration of suspensory ligament, which is the supporting framework of the mammary gland. Retraction of the skin is also due to infiltration of the suspensory ligament. Retraction of the nipple is due to the fibrosis of lactiferous duct, okay. Also we can see the orange peel appearance. Can you see it is pitted? This is orange peel appearance. You can see it is pitted. So this orange peel appearance which is seen in this case, the orange peel appearance which is seen in this case is also due to the presence of actually the blockage. So skin is giving an orange peel appearance due to the in the skin part because of the obstruction of lymphatic flow. Superficial lymphatics of the breast is obstructed. So this is very important because MCQ is asked about the about these features of the breast carcinoma, or a long question will come, then this kind of a clinical history will be provided to you. So please write on all the features of breast carcinoma. So please write on clinical features of breast carcinoma. Clinical features of breast carcinoma. Clinical features of breast carcinoma. Okay, it's a very, very important topic. So please note down, actually all these things will be asked in examination. So you can't leave this. Okay, it's very important that you should be knowing all the clinical features. So let's write it. So important features are, important point 1, presence of painless hard lump. self-examination of breast by the females should always be done. And if they feel anything abnormal, anything hard, or anything so any kind of swelling is there, or any kind of mass is there, they should contact they should go to the hospital and get the mammogram done. Okay, mammography done. This is very important. Now let's, and so many investigations are there. Okay, so breast become fixed and immobile. The breast becomes fixed and immobile due to infiltration of the suspensory ligament. So due to infiltration of suspensory ligament. Other features will be retraction of the skin. The skin will be retracted. There will be retraction of the skin and nipple. Retraction of nipple is there. So this is due to infiltration of lactiferous duct. Okay, this is due to infiltration of lactiferous duct. And a very important point which is always asked in examination is the orange peel appearance. Orange appearance. So if I talk about this orange peel appearance is of the skin will be seen in the case of breast carcinoma, and this is actually giving a pitted appearance to the skin, and this is actually like the skin of the orange, and this is due to obstruction of superficial lymphatics. This is due to obstruction of lymphatics. Due to the obstruction of lymphatics. Okay, dear. So we have done with this. Now the next thing is to know a few more important points about the clinical anatomy. So we have done with this. So I will like to, so one of the most important we have done, that was the mammary gland breast carcinoma. The other clinical anatomy, for example, the second point will be about the axillary tail. So sometimes it is important that the examination of the mammary gland and breast should be done in a proper way, and you should be knowing that there is a axillary tail extension from the outer lateral quadrant of the breast which is moving into the foramen of Langer, and sometimes if it is enlarged, it can be mistaken as an enlarged lymph node. So it can be mistaken as enlarged, lymph node. Other is other investigations. So there are various investigations. So if I talk about the various investigations which helps in the diagnosis of the case, so we will have a very important investigation which after 40 years every woman should go for this, that is as it's for the screening, it's a screening test, that is mammography. So it is soft tissue radiograph. What is it? It's soft tissue radiograph of the breast, and a well-defined opacity, cyst and all can be diagnosed by this process. Distortion and calcification of the mammary gland can also be appreciated by this procedure. The other is FNAC. So actually if I talk about FNAC, the full form is fine needle aspiration cytology. So this is the definitive test for the diagnosis of breast carcinoma. So if mammography is just a screening test which everybody should it should be routinely done by the women's more than 40 years of age to rule out the breast carcinomas and all. This is not the confirmative test. The confirmative test is fine needle aspiration cytology. Okay, this is used for diagnosis. So this is a diagnostic test. This is diagnostic test. Okay. Now also other few clinical aspects which you have to know. Actually, in case of later pregnancy and lactation, cracked nipple can be there. So in that case, if the cracked nipple can be present in case of later pregnancy and lactation. So in this case, if there is so lubrication should be done, and this is the washing of the nipples should be done, and lubrication should be done, and this lubrication can be done by lanolin. This will lubricate. Lubrication should be used for the breast. Discharge. So if there is any kind of lump, so discharge should be managed. Any kind of discharge or lump is seen in case of breast mammary gland, it should be certainly that management should be done as quickly as possible. Okay, now I just want you to show this image. What? Okay, this is the image which is showing you the appearance which is seen in different kind of actually these are the images of mammography, and you can see this is how the calcification appears. So basically, if you want, I can just enlarge. So this is showing you the mammography image in which you can appreciate, okay, the calcification of fibroadenoma. So this is how the calcification of fibroadenoma appears. Okay, you can see the calcification here in the center. Okay. So this is showing the calcification of fibroadenoma, and the enlargement or a benign tumor of the breast is the fibroadenoma, as you can see here. This is the outline for the fibroadenoma. Okay, now I just want you to show subareolar breast abscess. Can you see? This is mammographic appearance of soft tissue appearance of subareolar breast. This is the breast abscess, subareolar tissues involved. Now this is the case of breast multiple fibroadenoma, as you can see. This is how it appears. Cyst also I want you to show the breast cyst. Can you see here? Cysts are there. Multiple cysts are there. Fibroadenoma can also extend to various locations. So one of this image, you can see the fibroadenoma here is extending to the axilla. This fibroadenoma extension is going into the axillary region. Okay. This is the carcinoma of breast with calcification. Okay, and this is the calcified galactocele. So basically, I just want to reduce this. Actually, why I've included this images? Okay, it's like it's just to make you understand. Actually, from the first year only, the students should correlate the subject with the clinical aspect. So we should know. Actually, just to show you, you will write the name of mammography, you will write the name of breast carcinoma, you will write the clinical features correlated with the cause, you will write about different aspect, like you will write about cracked nipple, you will write about discharges, investigation, FNAC and all. Just these images will give you a look how the mammography helps in the diagnosis of the case. Now, that is important. Now, few more applied. So we have done many of the applied. If you want to know few more applied to be known. So basically, breast is also a source of, so if I am talking about breast infections. So breast infections and inflammations. If there is infection and inflammation in breast, so the term which is used is itis, mastitis. Okay, this can be by the formation of abscess. Tumor. So this was an applied. So actually, for so many applied I've done. If I talk about other applied, so I think so many applied we have already done. 3, 4, 5, 6. So okay, this was 6, 7. This was the 6th applied, and this will be the 7th applied. So other applied is tumor. So if I talk about the tumors which is seen in the breast, the important tumors will be, if I talk about the name benign tumors of the breast is called as lipoma and fibroadenoma. But always it should be followed up to see whether it is not having any malignant changes. So, and the other one which we have, breast carcinoma, we have discussed. And if I talk about malignant carcinomas, malignant breast carcinomas, and we have seen the spread also. So this will be actually, if lymph node is lymphatic, if I talk about the, there will be lymphatic spread, there will be a spread of metastatic cells via the veins, which we have discussed, and via lymphatic drainage. So one of an advanced stage, if I am talking about advanced stage of breast cancer, the lymph node which is involved is supraclavicular lymph node. So whenever if you see any of the breast carcinoma case in surgery department ward due to, and if their supraclavicular lymph node is involved, that means it is an advanced stage breast carcinoma. That is very important for you to know. So basically, if I am talking about malignant tumors, if I am talking about malignant tumors, what will be the presentation? So we have discussed so many things. I just want to summarize. The presentation of malignant tumor or malignant carcinoma of the breast will be like that of a hard lump with retracted nipple, pseudo-orange appearance, that is orange peel appearance, and advanced ulceration and fixation to the chest wall. So basically, coming to the 9th point, I just want to tell you a few important points. Malignant tumors which is of advanced stage. Malignant tumor, some clinical features. So malignant tumors, advanced stage, which will have few of the features which will help you to understand, yes, it is a malignant tumor and it is also of advanced stage, we can say. The presentation of the patient will be, or you just say that malignant tumor either advanced or not, but it is a malignant tumor because if it is having a hard lump. If the patient is having a hard lump, the patient is having hard lump with retracted nipple. With retracted nipple. The patient is having orange peel skin. Pseudo-orange. That is orange peel skin. So what is the reason? Involvement of the lymph flow. So involvement of the skin, and it is due to the cutaneous lymphatic edema and obstruction to the lymph flow. Now, other than that, in also this, and if I am talking about advanced stage, so advanced stage, if I am talking on malignant tumor, these are the features, and advanced stage, we will have the features like ulceration, fixation to the chest wall, and the patient will have breast cancer cells spread, metastasis to viscera's brain bone, viscera, brain, bones. So all these are advanced stage. So all these are the features of advanced stage carcinoma. Okay, what will be the treatment? The treatment is multiple in case of malignant tumor. Hormone therapy. There will be either you can go for hormone therapy, you can go for radiotherapy, you can go for hormonal therapies, chemotherapies. All types of therapies are present. So the advantage is there that multiple therapies are there for the treatment of breast carcinoma, and the patient has got good survival also if it is diagnosed in early stage. Okay, so breast cancer will have nipple retraction, skin dimpling, pseudo peel orange appearance. So I just wanted to share an image. So this is an image which I want you to share how it looks. So you can see A image is, there is A, there is B, and there is C. So there will be actually spread. So A is actually ligament of Cooper is like not giving support, retracted, infiltrated. And the milk duct is involved, lymphatic obstruction is there, which is giving you the dimpling of the skin. That is also very, very importantly seen. Okay, so done with this. And as I have told you, Crookenberg tumor already, just a few important points. So some lymphs, so basically Crookenberg tumors, which we have discussed and shown in the diagram, inferomedial quadrant of breast. If I talk about inframedial quadrant of breast, it is communicating with, so it is communicating with subperitoneal lymph plexus. So what does that mean? This will be following a route of transfer or spread of cancer cells from here, and this can go transcilomically to ovaries, and this can form an ovarian tumor which is called as Crookenberg tumor. This will lead to the formation of Crookenberg's tumor. Is it okay? So this we have also discussed in the lymphatic वाला session जब मैंने diagram बनाया था, I have shown you how the spread happens. Now here I just want you to show this image where you can appreciate the Krukenbach tumor. So Krukenbach tumor is the secondary deposit which is seen in ovaries. Okay, it's a secondary deposit which is seen in ovaries. Spread happens via carcinoma. So you can see here, this is a big Krukenbach tumor. So spread happens from carcinoma of breast. Lymph from which part or quadrant of breast can drain here, or cancer cells can be carried via, that is from the spread happening to inframedial aspect of the breast. Then it will communicate with rectus sheath, it will communicate with subperitoneal plexus, drain into subdiaphragmatic lymph node, passes, it can pass through the falciform ligament also, and can reach the hepatic nodes and can lead to the obstructive jaundice also. Okay, so one of the thing is that it is going towards the, it is traversing towards the ovary. It will also communicate and through the falciform ligament and can reach towards the subdiaphragmatic lymph node and can reach all to the hepatic nodes and can cause obstructive jaundice. Okay, so that is an important point which you have to know. Okay, now dear, now I want you to show this image where you can see congenital anomalies which can be seen due to developmental cause. So polythelia, more than one supernumerary nipples over the breast. Athelia, no nipples. There is no nipples in the breast, accessory breast. Polymastia, accessory breast along the milk line. Can you see the line which has been shown is the developmentally the line of milk ridge. Amastia, no breast development. Amasia, nipple developed but no breast development. Okay, these are the terms which you have to know. You can know, you have to know these terms because this can be asked in the Viva examination. So all these points which I have mentioned. So we are coming to the end of the session, and where I have explained all the breast carcinomas, all the clinical aspect in detail, and I have described breast in much more detail. Those who are live and those who will watch this session, they can solve each and every MCQs and each and every long short notes or any kinds of enumeration MCQs for the university paper. But before ending, as I told you, few MCQs you have to discuss with me. So I am going to discuss few MCQs with you. Is it okay? Can we do that? Let me just check the students if they are okay with this. Yes, I can understand today's session is slightly longer. Why? Because I wanted to discuss each and every aspect of mammary gland, a very, very important topic for your university papers. Let's see here. So let's start with the first MCQ. Okay, I will read this MCQ for you. Okay, let's see here. So the MCQ is, a 45-year-old woman is being examined as a candidate for the cosmetic breast surgery. Okay, the surgeon notes that both of her breasts sag considerably. So which structure is most likely stretched in this condition to result this condition, sagging of the breast? Whether the structures stretch is carpa fascia, pectoralis major muscle, pectoralis minor, suspensory ligament or Cooper, serratus anterior muscle. So structure that most likely becomes stretched, and because of that there is a hanging down ptosis, or the hanging of the breast, that is mainly seen after 45 years of age in women, is due to suspensory ligament of Cooper. So basically this is due to the suspensory ligament of Cooper, which is forming the stroma, and this forms a supporting network for the breast and mammary gland. Everyone, okay, if any of you are not able to solve this MCQ or not understanding anything, please let me know. So that is the thing. That is the reason we will mark suspensory ligament of Cooper as the right answer. Okay. Now, all are true about mammary gland. All of these points are true about mammary gland except it's a modified sweat gland. Okay. So basically it's absolutely correct, dear. I have told you in the introduction part that breast or mammary gland is obviously modified sweat gland. So this is correct statement. We have to choose the incorrect. Extends from second to sixth rib vertically. This is also absolutely correct. Why? I have told you the vertical extent of the mammary gland is happening from second rib to the sixth rib. That also I have told you. Supplied by internal mammary artery is also absolutely correct. We have also discussed the arterial supply and we know that it is also correct statement. Nipple is located in sixth intercostal, nipple is supplied by sixth intercostal nerve is not right, because if you remember, nipple location was corresponding to, so nipple is, if I'm talking about the location of nipple, it is corresponding to intercostal space 4, and so the nerve supply via intercostal nerves Sixth is the not the right answer. So nipple is supplied by 6 intercostal is the wrong statement, incorrect statement. So it is the right answer. Got it? Okay. So basically, if I am talking about the nipple areolar complex, it will receive innervation via fourth. What is the innervation? Will be via fourth intercostal nerve. So this is the right answer. Okay, so this D option was incorrect statement. Now moving to the next question, that is question number 3. Lymphatic drainage of upper quadrant of breast will be mainly going towards anterior group of axillary lymph node, posterior group of axillary lymph node, paratracheal lymph nodes, or none of the above. So if I talk about primary pathway of upper quadrant lymphatics, so if I am talking about, actually the right answer is actually anterior or pectoral group of lymph nodes. So basically if I am talking about primary path of upper lateral quadrant of lymph node, upper quadrant of breast lymphatic drainage, it will go into anterior. It will go into anterior, which is also called as pectoral group of lymph nodes. This is the right answer. Now moving to the next MCQ, that is MCQ number 4. Pseudo orange appearance which is seen in the skin of the breast, so occurs due to, what is the reason? Whether it happens due to hematogenous dissemination, whether it happens due to adherence of Cooper's ligament, whether it happens due to blockage of subdermal lymphatics, or whether it happens due to the chest wall fixation. So the correct answer here will be blockage of subdermal lymphatics. Subdermal lymphatics. Actually what happens in the case, I would like to tell you the mechanism also. If you want to know, please note down. Cancer cells of the breast carcinoma obstruct. Cancer cells obstruct. So cancer cells obstruct the or block. So what they do, they obstruct or block subdermal lymphatics. So they will lead to the blockage of subdermal lymphatics, okay, my dear students. And this will prevent the proper, what will this do? This will prevent the proper drainage of lymphatic fluid. This will prevent so there is no proper drainage of the lymphatic fluid, and this will lead to localized edema, lymphedema. This will lead to localized lymphedema because of this skin is fixed in the part of Cooper's ligament. So this, so basically what will happen? This will lead to localized lymphedema. Actually, many of the students get confused for this region and they mark Cooper's ligament. Actually, what will happen? The skin will localized edema will be there, or swelling will be there, and there will be also fixation to Cooper's ligament. So Cooper's or suspensory ligament. So there will be swelling of the skin and fixation due to Cooper's ligament. So this will appear like a orange skin. This will give an appearance of orange skin. So I know that Cooper's ligament is involved. We know that Cooper's ligament is involved in the case of breast carcinoma. But if the question is particularly asking about the region, so primary region is blockage of subdermal lymphatics, which is done by cancer cells. So we will mark the right answer as C. Is it okay? Okay. Now, how many? This is a very easy one and direct. So this is very easy and direct one. Actually, one more note point everybody should know, that Cooper's ligament is involved in creating. So basically one note point is that Cooper's ligament are involved in creating dimpled appearance, but primary cause of pseudo orange appearance will be lymphatic obstruction. What will be the primary cause here? But the primary cause of this appearance will be, important point is blockage of lymphatics, is the blockage of lymphatics. This is very important because so many students, and this is also asked in the Viva examination. So please note the exact reason. Okay. Now coming to a very direct MCQ and easy one. How many lactiferous duct opens in a nipple? How many lactiferous ducts opens in the nipple? Options are 0 to 10, 15 to 20, 25 to 50, 50 to 75. So if you have to mark the most correct answer, typically if I talk about lactiferous duct opening, in the case of the nipple and converging there, we have to mark the right answer. So definitely 15 to 20 is the most correct answer, and so we'll mark B as the right answer. Okay, now students, we have come to the end of the session. I hope the session amply, okay, so yes, the session is very useful for you. What I want from you is go to the entire session. Actually, so many diagrams I have made. Actually, it's like different, like either the short notes can come, either the relations can come, either the lymphatic drainage can only become, either the clinical anatomy can become, clinical cases can be made and asked as a long question. So multiple things can be asked from this particular topic, that is mammary gland. It's a very important topic for long question. It's a very important topic for MCQs. It's also very important for competitive exam or next examination, which is going to happen in the near future. So I just want everybody to go to the details of all this and practice the diagrams along with me. Now I have already started the gross anatomy sessions class. I have started with the upper limb. The first topic which I have taken was the pectoral region, in which I have covered one university paper question, that was the clavipectoral fascia, and some Viva questions about the muscles, and I have shown you so many cadaveric images and sections so that you can identify the muscles. The second session which I have taken is of mammary gland, which is a very important university question for the long question or essay type of question being asked. So please go through this session and be the part, or practice all the images and diagrams which I have made. Use proper colors: red for the arteries, blue for the veins, generally ligaments के लिए green, brown for the muscles, and yellow for the nerves. All the best and keep studying. Thank you so much. We'll meet exactly tomorrow at the same time, 6:30 p.m. See you there. Thank you so much, my dear students. Thank you.